Hi PSA members, in this week's President's Update, I have a number of things to keep you in the loop. The first is we know that currently we are about 2 months into the implementation of the first part or the first stage of the 60-day prescription, and we know that there are ongoing concerns on the ground. Members will remember that during the start of that 60-day prescription implementation, we asked members to send in your concerns and anything you'd like to raise directly with the department to our email inbox, which was 60daydispensing@psa.org.au. So our team have been working really hard in the background and reading every single feedback and submissions that have come through. So far, we have received over 300 emails, specifically around 60-day dispensing. And so in addition to our weekly meetings and updates with the department, the PSA team have also put together a formal written submission compiling all of your concerns about 60 days, and we will be sending this to the department very shortly, so there is a documentation of that submission. In the report, there were various scenarios or themes, all the way from issues when patients were prescribed 60-day prescriptions when they were not stable, to scenarios where there were quantities of medicines prescribed that exceeded the therapeutic need, to patient being unaware of 60-day prescription and the rules, all the way to scenarios where there actually was minimal or no cost saving at all for patients. So there were various concerns. And in the submission, we're also including very specific examples to the department. Along with that, we are putting forward a series of recommendations to the department around how this could be managed. So watch this space, and we are continuing to advocate, obviously, for pharmacists to be able to continue to provide safe and equitable care and access to medicines by all Australians. Now, the other thing as well to mention is that PSA is continuing our conversations with the department and the Minister's Office around 8CPA, and the conversations are ramping up at this stage. We have also started the meeting where we serve on the Scope of Practice Review Expert Advisory Committee. The first committee meeting, formal committee meeting, was yesterday. And of course, we're flying the flag for pharmacists, highlighting how pharmacists should be supported to practice to a full and top of scope. We can do more, but we cannot continue to do more without support. So we're making that very clear. We're also making it very clear that there are currently a number of barriers stopping pharmacists from practicing to a full and top of scope, including systems barriers, funding barriers, regulatory barriers, and all of which will need to be addressed at some stage. Also, I'm very excited to announce that today we are releasing our PSA annual report for the financial year ending 2023, and this will be a public-facing document highlighting PSA's achievements during that financial year, but also what our members represent in the profession and the contribution that the profession makes. And this is quite important because having a public-facing document like that really can showcase to external parties who may not fully understand, who PSA is or what pharmacists do in our profession. So this is actually one step forward to try and bring pharmacists to light in terms of our contribution to our health system. Lastly, for those of you who do check your emails regularly, you may have received an email, or you will have received an email from our PSA membership team. We are running a member pulse survey at the moment. We're obviously very committed to make sure that PSA continues to deliver the best experience for our members. And we know that we can do better. It's not perfect yet, and we're very keen to hear from members around how and what we can do better to support our members. So if you haven't had the chance to do that, please take a couple of minutes of your time. We'll really appreciate that. If you could please complete that to help us do better. Thank you.